Go.
All right, so we have Miss Jones. She's receiving chemo treatments and has vomited. She's a patient on 100% non-rebreather mask. Her SATs are at 91. Breath sounds are coarse and roncorous. She has a cough, but it is ineffective, and she is feeling like she cannot breathe and is panicking a little. What happened to her, and what should you do? So since she went ahead and vomited, she is an aspiration risk. So that would be one of our major indications for going in and doing a nasotracheal suction. So we'll go ahead and gather our equipment, review the chart for any contraindications or allergies, of which she has none. And we would go ahead and gather equipment, go into the room, get her 2 patient identifiers, explain why we believe that nasotracheal suction is the best thing for her, and then go ahead and get her consent to go forward with the procedure. So I'll go ahead and wash my hands and put on some gloves.
Can I get your name and date of birth? Perfect, Mrs. Lewis. So your stats are a little low. Respiratory rate is 18. So we have Mr. Burns. Did you look a little yellow?
What are gloves? The gloves. Yeah.
Do you get tired when you walk up the stairs?
Medium. I think she found them.
Keep that on. I'm gonna explain that you have to hyperoxygenate you, so we're gonna have that on the
So,
procedure.
I'm gonna go ahead, put on some gloves. Now, as far as equipment goes, I do have my suctioning kit. And then since suctioning is a sterile procedure, I have a pair of sterile gloves as well. So we'll put the regular gloves on. We go ahead, enter the room, make sure we have the right patient by asking for name and date of birth, and then we can go ahead and get pre-vitals. So what I would do is go ahead and get breath sounds. And at the same time, I'm counting respiratory rate, looking for any color changes like cyanosis. I would go ahead and look for color, any deformities. And at the same time, put a pulse ox on her to get respiratory rate and saturation. All right. And then I would go ahead, explain the procedure, get her consent, and go forward. So with a sterile procedure, you want to go ahead and open the gloves, making sure not to touch anything but the outside of the container. Go ahead and open our kit. Also making sure not to touch what's inside, since that is technically sterile. And then we would go ahead, put a little bit of lubricating jelly right on here. That way we don't have to touch that container again. And go ahead and get our sterile water open. All right. So I'll go ahead and touch the inside of the glove with my hands. Put that glove on, not touching any other part of the glove. So since this is technically sterile, I can go ahead and grab it with this part. And since that white part is not sterile, I can go ahead and touch it with this hand. Okay. And then at this point, I would go ahead, and since she's been hyperoxygenated, take that off. I would connect this part to my suction machine. And then since she is an adult patient, I would go ahead and test the machine pressures and set her anywhere between 120 or 150 millimeters of mercury. And then go ahead and lube this tip right here. All right. And then I would go ahead and go in just bit by bit, making sure that I go until either I hit resistance or she coughs. Right, we're gonna just pretend that she coughed there. At that point, I would go and recede just a little bit, turn my suction on, and then occlude this little hole as I'm pulling out and rotating. Right? And then give her a little break, and then do that procedure again. And then going in until I hit resistance or she coughs. And then occluding as I'm withdrawing and also rotating, just to try and prevent any kind of damage to her nasal tracheal lining or any bleeding. And then once I'm done with that, I can go ahead and take all of my suction equipment, put it all away, make sure the mask is back on her face, and then do post-vitals. So then again, we're checking for dyspnea, color, respiratory rate, breath sounds, and then putting that pulse ox on her to get her heart rate and her sats. And then at that point, I would go ahead and gather up all my trash. I would make sure that she doesn't need anything else from me and she knows where her call bell is. And then I would go ahead and chart my findings.